Good morning, good morning, students. Myself, Lija ma'am. Let us enter into the last topic of our unit, healthcare delivery system in India. So today we are going to see regarding the organization and delivery of health services in urban area. How it will be distributed in the urban area, or what are the health services provided in the urban area. So before that, we should know about the administration of health services in India. Actually, this topic I am not dealing with. It is a unit which is going to be covered by Sister Smita. So in that unit, Sister will be dealing thoroughly or in detail regarding what is the administrative health administration in India. So you should never be get confused with these two topics. Healthcare delivery system means how the healthcare is delivered to the public or to the people. So in that we have studied already in this unit through public sectors, through private sectors, through voluntary health agencies, through various national health programs, through Ayush or indigenous system of medicine, through the various health insurance policies in India. So these all were the healthcare delivery system. But when we are studying health administration, we are going to study regarding the central level, state level, district level, and to the periphery levels. So from this flowchart, I am just briefing you about what it looks like, because when we are entering into the urban area, you should really know where the urban areas are coming under which area we are telling about the urban regions. So when we look into this, the national level, in the national level, the health sector is controlled by Ministry of Health and Family Welfare. Then we have various states and union territories. So under the states and union territories, we have Ministry of Health and Directorate of Health. Then there are district health organizations, and where we see basically the specialized hospitals or the district hospitals. So from there we can see there will be a division. Like from there, usually below the district, we will be usually dividing the health sectors into urban and rural sectors. So here I have just shown the periphery levels. Like we have seen, like from there we have the community centers and primary health centers, and we have sub centers, and we have the periphery workers like village health guide, trained dais, the health workers male and female. So here I have mentioned the population coverage also. Like there will be one village health guide, or there will be one dai, or there will be at least one asha worker for 1000 population, and there will be one sub center for 3000 to 5000 population, and there will be at least one PHC for around 20,000 to 40,000, or 20,000 to 30,000 population. It varies, as I have told, in the plain area and in the hilly area. And we have one community health center, that is CHC, minimum for 80,000 to 1,20,000 population. So this is all about how the health system in India looks like. So in the health system of India, as I have told, we have mainly three links. That is the central government, then comes the state government, and then the local or the periphery area. So in the central level, it is mainly officiated by three main official organs. That is the Union Ministry of Health and Family Welfare, the Directorate General of Health Services, and the Central Council of Health and Family Welfare. I am not going into the details. Why? Because this unit is going to be dealt by Sister Smita. So you should just understand and by heart these things. Under central government, it is officiated, or the health system is controlled by these three main official organs. And when it comes into the state level, we have two main departments, that is the State Ministry of Health and the State Health Directorate. This is the health administration under the state level. And when it comes into the district level, especially we know that it is the principal unit of administration in India. So here in the district level, around for a rough figure I can tell that around 593 districts in India, and we have various 6 administrative areas like regions we can tell. So all these regions, again it is subdivided into subdivisions, and again it is divided into tehsils or taluks we can tell it as. Then there will be community developmental blocks, CDB, community developmental blocks we have. Then again it is divided into municipalities and corporations and villages and panchayat. So here let us see where the urban and rural differences comes. So in the district level organization, we all know that the collector will be the head of the district level, and the subdivisions will be controlled by sub collector or the assistant collector, and the tehsil or the taluk, it will be headed by the tehsildar. That means at least one tehsil or one taluk means around 200 to 600 villages will form one taluk, and one block, that is the block means since it was known as the community developmental program in 1952. Till that time it was known as block, and now it is known as block developmental block developmental officer controls that. The block is controlled by block developmental officer. So like from 1952 onwards, we have this community developmental program. Under that we started more emphasizing about the blocks also. So here comes my major part. So under the district, so till now we have seen that central government, then state government, then the district level. So from the district organization we can see that the health services has been divided under 2 pillars, that is urban area and rural area. The health services of urban area, the health services provided for rural area. So here we can see very clearly that in the urban area we have town area committees, like where it covers a population of 5,000 to 10,000, and we have municipal boards like 10,000 to 2 lakh population, and we have corporations where there is more than 2 lakh of population. Rural area, there it is divided into community developmental block, CDB, and we can see village panchayat. So village panchayat is the periphery level of a rural system, and corporations are the periphery level of a urban area. So let us see in a rough what is the rural administration. Rural administration, we all know that the local rural governing system in India, that means the linking of village to the district, that link is controlled by Panchayat Raj institutions. That is a 3-tier system. Panchayat Raj institution is a 3-tier system because it has 3 parts or 3 structures. One is at the village level, which is known as the Panchayat, and then at the block level we have Panchayat Samiti, and at the district level we have Zila Parishad. So these 3 things you have to by heart. At village level we have Panchayat, and at the block level it is known as Panchayat Samiti, and at the district level we have Zila Parishad. Again I am telling these all things will be covering in the unit health administration. So there it is one of the important essay also, or we can tell it is one of the important essay which is focusing for your final exam, health administration. And sometimes even for 5 mark they ask about the urban health services, they ask for what is Panchayat Raj institutions. These questions are usually or frequently asked in community health nursing. At the village level, we can see in the Panchayat, at the village level, that is in the Panchayat level, we have again 3 things: Grama Sabha, Grama Panchayat, and Nyaya Panchayat. The Grama Sabha, that means it involves all the adults in the village. They elect the members of Grama Sabha. From here, the Grama Sabha, they elect all the members towards the Grama Panchayat. So the people or the members are all the adult, those who belongs to that particular village. Then Grama Panchayat means it is the executive organ of Grama Sabha, and around 15 to 30 members will be the part of Grama Panchayat. It covers a population of 5,000 to 15,000 population. Once the members are elected, they will be elected for 3 to 4 years, that particular Grama Panchayat members. Every Panchayat has an elected president. Either we known as Panchayat president, or towards the north we tell it as Sarpanch, Sabhapati, or Mukhya. we have heard these words in the Tamil movies and all, or if you see Hindi movies, we can see these type of words for the Panchayat president. Then they have a vice president and a Panchayat secretary. So this is Grama Panchayat. Then they have a Nyaya Panchayat also, where in some movies you have seen that that is a local court type system. If they have some problem, usually they try to take up or raise that issue in the Nyaya Panchayat, and they try to solve that problem in the Nyaya Panchayat. ഒരു കോർട്ട് പോലെ ആക്ട് ചെയ്യുന്നു അല്ലേ, ഒരു ജുഡീഷ്യറി സിസ്റ്റം പോലെ. നമ്മൾ കോർട്ടിലൊക്കെ കേസ് കൊടുത്ത് പോകുന്നതിനേക്കാളും ഗ്രാമത്തിലുള്ള എല്ലാവരും കൂടി ഒരു ഗ്രാമത്തലവൻ അല്ലെങ്കിൽ ഗ്രാമത്തിലെ ഗ്രാമസഭയിൽ നമ്മൾ എലക്ട് ചെയ്ത ആളുകളെല്ലാം കൂടെ ഇരുന്ന് അതിനെക്കുറിച്ച് ചർച്ച ചെയ്ത് ആ പ്രശ്നം സോൾവ് ചെയ്യുന്ന ഒരു രീതി, അതാണ് ന്യായ പഞ്ചായത്ത്. സോ ദീസ് ത്രീ തിങ്സ് ആർ ദ ബേസിക് ഗ്രാസ് റൂട്ട് ലെവൽ ഓഫ് എ വില്ലേജ് ലെവൽ ഓർ എ പഞ്ചായത്ത്. At the block level, we can see Panchayat Samiti, and at the district level, we were having Zilla Parishad. This is all were regarding the rural administration. Let us see in brief about the urban administration, how the urban administration is. In the urban administration, the local self-government in the urban areas of the district is divided into three main parts, that is town area committee, municipal board and the corporations. So we have seen how much is the population coverage also. So the first one is town area committee. So in the town area committee, in the areas having population which is ranging from 5,000 to 10,000, we will be having at least one town area committee. These are acting like panchayats. So how in the rural area the panchayat stands, the same like the town area committee stands in the urban. റൂറൽ ഏരിയകളിൽ പഞ്ചായത്ത് എന്ന് പറഞ്ഞാൽ എങ്ങനെയാണോ അതുപോലെ തന്നെയാണ് അർബൻ ഏരിയകളിലുള്ള ടൗൺ ഏരിയ കമ്മിറ്റി എന്ന് പറയുന്നത്. ആൻഡ് ഇറ്റ് റിയലി പ്രൊവൈഡ് ദ സർവീസസ് ലൈക്ക് സാനിറ്ററി സർവീസസ് ഇൻ ദ പർട്ടിക്കുലർ ഏരിയ. അവർ ഹൈജീനിക് ആക്ടിവിറ്റീസിനും എൻവിയോൺമെൻറ്റൽ സാനിറ്റേഷനുമാണ് കൂടുതൽ ഫോക്കസ് കൊടുക്കുന്നത്. Then comes the municipal boards. So the municipal board, it covers a population of 10,000 to 2 lakhs, as I have told. So 10,000 to 2 lakh population it will be covering. The municipal board is headed by a chairman, or we can tell as a president, and he or she is elected usually by its members. The term of the members ranges from 3 to 5 years, same like what we have told in urban rural area. Same thing will be happening in urban, only thing the name varies. Here it is town area committee and municipal boards. There the name is like Grama Panchayat and Grama Sabha, all these things. The municipal board looks after. So what is the function of the municipal board? Here they also takes care of the function like sanitary function, the drainage facilities of the urban area. It should be the closed drainage, how the drainage system should connect to the main drainage system, regarding the public water supply, regarding the construction of new roads, regarding the maintenance of the roads, the tarring and all the maintenance work of the road, and regarding the registration of the birth and death in that particular urban area, and especially regarding the educational facilities in the particular area. And they run various hospitals under this municipality board. We used to hear about municipality hospitals. So it is run by municipal boards, and even they have municipality dispensaries also. So these are the functions of municipal boards. The third one is corporations. So what is the function of corporation? Corporation usually comes when they have a population, the area has a population more than 2 lakhs. 2 ലാക്സിൽ കൂടുതൽ ആളുകൾ താമസിക്കുന്ന ഒരു അർബൻ ഏരിയയെ നമ്മൾ കോർപ്പറേഷൻ എന്നാണ് വിളിക്കുന്നത്. സോ ദ കോർപ്പറേഷൻ ഈസ് യൂഷ്വലി ഹെഡഡ് ബൈ എ മേയർ. വി ഓൾ നോ ദാറ്റ് ദ ഹെഡ് ഓഫ് ദ കോർപ്പറേഷൻ ഈസ് the mayor. Its members are the councillors who are elected from various wards of the city. So there are various urban wards in the city. So from each of the ward there will be elected members. So those elected members will be the councillors. They all will be the members of this corporation. The corporation has the executive agency headed by the commissioner. They have an executive agency, and the head of that committee or head of that executive agency will be the commissioner. It has secretarial staff headed by the secretary, and the health officers and the engineers. In the corporation we have a secretarial staff. That means they will be directly in connection with the district level. So they have people headed by the secretary and the health officers, those who belongs to the district level, and even the various engineers. So they take care of the infrastructure facilities, they take care of the drainage infrastructures, they take care of the public water supply, all these things, these engineers. And it carries the similar functions that of a municipal board, but in a larger and wider scale. Municipal boardil അവരെന്തൊക്കെ ഫങ്ഷൻസ് ആയിരുന്നു ചെയ്തുകൊണ്ടിരുന്നത്? They take care of the drainage system, they repair the road, construction of the road, maintenance of the road, water supply, public water supply, purification, everything. The same way here also the corporations also do all these things, same thing, but in a broad scale or in a wider scale, because the population coverage is much more here. Minimum of 2 lakh population when it is covering, there only the corporations comes. Now let us see, or now let us enter into the topic which is in this particular unit, that is the health services provided in the urban area. ഇപ്പോൾ നിങ്ങൾക്ക് അർബൻ ഏരിയ എന്നുള്ളത് കൊണ്ട് എന്താണ് ഉദ്ദേശിക്കുന്നതെന്ന് ഒരു ഐഡിയ കിട്ടി എന്ന് ഞാൻ മനസ്സിലാക്കുന്നു. So as I have told, when you study in detail about the health administration in India, then you will have a clear picture when you incorporate this particular unit, healthcare delivery system, and when you incorporate these topics with the health administration in India, that is how it comes from the central government, how it reaches the state government, how it reaches the district, and how it reaches into the urban and rural areas. Then only you will have an overall picture about the health system in India. So here today we are going to study about the services which are rendered, or the health services which are rendered especially in the urban area. So in the urban area, one of the main service rendered is MCH services. So MCH services are available through the district health organization. I have told you, from the district only rural and urban it is divided. So all will be available directly from the district health organization, supported by government and various non-governmental organizations. Here comes the role of NGO. We have already studied various NGOs. What is NGO? Voluntary agencies. So they actually support the functions of all functions of government. So wherever the government is not able to focus, wherever the government is lagging, there they give the supplementary function, they give the support by the voluntary health agencies. Otherwise it is known as non-governmental organizations. So all the MCH services in the urban area is provided directly from the district health organization by the support of government and other NGOs. The government setup consists of all these things, like they have district family welfare centers, special district family welfare centers, they have district postpartum program unit, and they have urban MCH centers or clinics, they have maternity homes, they have hospitals run by the municipal corporation and civil body. That's what I was telling. We have heard about the municipal hospitals, municipality hospitals, or the corporation hospitals, corporation clinics. So these all were running under this. Then they have district and state level hospitals. So under the urban area we have this also, and they have health post in urban slum. Especially in the urban slum we can see there will be more focus given. How we give the focus in the rural area, we give more focus in the urban area, especially in the urban slum areas, because they will be thickly populated, and we have to take care much about the sanitation of the particular area, because drainage system, everything has to be taken care, the drinking water facility, because if some epidemics happens in the particular area like a urban slum, it will usually transmit, or it will have a very fast mode of transmission. So in order to prevent that, there will be more focus of health post in the urban slums. Then we have urban family welfare centers. So in the urban family centers also they provide all the facilities whatever we have studied under the MCH. Already we have studied the topic MCH. So you are, by this time you are clear with what are the MCH services. All the maternal and child health services will be even provided in the urban areas also under this various platform. The non-governmental organizations, that means the NGOs for MCH and family welfare, they do various activities, like they have nursing homes and hospitals, and the voluntary organizations and charitable trust. We used to see there's some hospitals which is run under the trust, which is run under the voluntary organizations, and they take up the private practitioners of all the systems, because we have seen the integration of the private system into the government system. It will really help the Indian government to bring up the health system in India, because only with public sectors they have limitations. They have the limited number of doctors, and they have limitations in the services, because our population is much more. So they integrate the non-governmental organization or the voluntary health agencies. They try to integrate the private practitioners also into the system. It is also done through the urban centers. And the various family welfare services in urban areas are, the first one is the postpartum program, second one is the pap smear test facility program, the third one is sterilization bed scheme and urban revamping scheme, and we have urban family welfare centers. So these all are the important family welfare services which is run especially in the urban areas. So let us see regarding each one by one. The first one is postpartum program. So from the word itself you will be able to know that what is postpartum program. So here the program really encourage the women who is in the reproductive age, that is between around 15 to 44 years, or even their husbands. They will be encouraged, or they will be motivated to adopt a small family norm. It can be done only through education and motivation, particularly during the prenatal and postnatal period. So when they are giving services in the postnatal period after a delivery, they really motivate the couple. They really motivate the reproductive age group people, either women or the husband, and they try to make them to adopt a small family norm. So here all in the family welfare programs we can really see that they really focus upon the reduction of population, because the rapid increase in the population is one of the major issue where we are not able to handle many problems in the health sectors. In India we know that we have so much of sophisticated system. നമുക്ക് എല്ലാവിധ സൗകര്യങ്ങളും ആവശ്യത്തിനുള്ള ഹോസ്പിറ്റലുകളും എല്ലാം ഉണ്ട്. പക്ഷേ നമ്മൾ ഫേസ് ചെയ്യുന്ന ഒരു പ്രധാന കാരണമെന്ന് പറയുന്നത് നമ്മുടെ പോപ്പുലേഷൻ തന്നെയാണ്. സോ വി ഹാവ് സച്ച് എ റാപ്പിഡ് ഇൻക്രീസിങ് പോപ്പുലേഷൻ. സോ ദ മെയിൻ എയിം of the postpartum program is to bring up or adopt a small family norm by the reproductive couple. The postpartum centers, they also function as referral centers for providing various MCH and family welfare services. എല്ലാ ഫാമിലി വെൽഫെയർ സർവീസസ് എന്ന് പറയുമ്പോൾ എന്തൊക്കെയായിരിക്കും അതിൻ്റെ കീഴിൽ വരിക? ഞാൻ ഓൾറെഡി പറഞ്ഞു, ഫാമിലി വെൽഫെയർ സർവീസ് എന്ന് പറയുമ്പം നമ്മൾ പെർമനൻറ്റ് ആൻഡ് ടെമ്പററി ഫാമിലി പ്ലാനിങ് മെത്തേഡ്സ് മാത്രമായിരിക്കരുത് മനസ്സിലോർക്കേണ്ടത്. ദർ ആർ സോ മച്ച് ഓഫ് ആക്ടിവിറ്റീസ് ലൈക്ക് അഡോളസെൻറ്റ് ഗേൾസ് കൗൺസിലിങ്സ് ആർ ദെയർ. വി ഹാവ് സ്ക്രീനിങ് for anemia is there. So many things are there coming under the family welfare services. So the family welfare services and the maternal and child health is incorporated in the postpartum centers. They even act as referral centers for these particular services. It is functional at the district level, sub-district level, and even in the താലൂക്ക് ലെവൽ ഹോസ്പിറ്റൽസ് ഓൾസോ. സോ ഈ പ്രോഗ്രാം നമുക്ക് ഡിസ്ട്രിക്ട് ഹോസ്പിറ്റലിൽ ചെന്നാലും സബ് ഡിസ്ട്രിക്ട് ഹോസ്പിറ്റൽ അല്ലെങ്കിൽ താലൂക്ക് ലെവൽ ഹോസ്പിറ്റലിൽ ചെന്നാലെല്ലാം അവൈലബിൾ ആയിട്ടുള്ള ഒന്നാണ്. സോ ദർ വിൽ ബി എ സെപ്പറേറ്റ് റൂം ഫോർ പോസ്റ്റ്പാർട്ടം പ്രോഗ്രാം. ദിസ് ഈസ് ദ ഫസ്റ്റ് സർവീസ് which is given in the urban area under the family welfare service. So under the postpartum program there is a set of pattern of input in the form of staff, equipment. They will be having extra staff specially designed or specially trained for postpartum program, specially to motivate the small family. No, and they will be having special supply of equipments, and there will be construction of a ward or a operation theater. All these things will be specially provided under this program. The program is around 100% centrally assisted, and the full amount will be given from the central government and is only implemented through the state government. All these centers will be having the branches in the district, sub-district and the taluk level, and financially it is 100% assisted by the central government. Under this program, a good percentage of sterilization and IUD insertions are happening every year. So the statistics shows that there are more number of sterilizations, that means tubectomy, vasectomy, and even all the IUD insertion, intrauterine device insertion like copper T insertions, Lippes loop, all these things happens in this particular centers, that means through this program, that is a postpartum program. So it really focus upon the reduction of population in India. So the second program given in the urban area is pap smear test facility. So what is pap smear test? I hope you all have studied in OBG, or you will be studying in OBG. It is pap smear means it is used for the early detection of cervical cancer among the women. So like pap smear testing is actually little costly in the private sectors. So here really the government is trying to focus on the reduction of cervical cancer among the women. So this program has been approved by the government of India almost in around 105 medical colleges which are equipped with a full-fledged department of pathology. So in many medical colleges in India, they have a full-fledged department of pathology, and the services will be rendered, and even they under the organization or even under the supervision of a senior pathologist. അല്ലേ, ഒരു പ്രൊഫസർ ഓഫ് പത്തോളജി എന്ന് പറയുന്ന ഒരു പോസ്റ്റ് ഉണ്ട്. ദാറ്റ് മീൻസ് ദ സീനിയർ മോസ്റ്റ് പത്തോളജിസ്റ്റ്. സോ ദാറ്റ് പേഴ്സൺ വിൽ ബി the head of this particular program. That means he will be guiding this program, that is the pap smear test facility program. The post of a cytotechnician for preparation and examination of slides and contingent expenditure for purchase of glasswares and chemicals has been provided by government. ഈ പ്രോഗ്രാമിൻ്റെ അടിയിൽ സൈറ്റോ ടെക്നീഷ്യൻ എന്ന് പറയുന്ന ഒരു പോസ്റ്റും കൂടെ ഗവൺമെൻറ് പ്രൊവൈഡ് ചെയ്തിട്ടുണ്ട്. സോ വാട്ട് ഈസ് ദെയർ ഫംഗ്ഷൻ ഈസ് ദേ റിയലി പ്രിപ്പയർ ആൻഡ് എക്സാമിൻ ദ വേരിയസ് സ്ലൈഡ്സ്. ഈ പാപ് സ്മിയർ സ്ലൈഡ്സ് ഉണ്ടാക്കുന്നതും അത് പ്രിപ്പയർ ചെയ്യുന്നതും അത് എക്സാമിൻ ചെയ്യുന്നതും അതിന് വേണ്ടിയിട്ടുള്ള എക്സ്പെൻഡിച്ചർ വഹിക്കുന്നതും, ദാറ്റ് മീൻസ് ദ പർച്ചേസ് ഓഫ് ദ ഗ്ലാസ് വെയേഴ്സ് ആൻഡ് ദ കെമിക്കൽ റിയേജൻസ് വിച്ച് ഈസ് നീഡഡ് ഫോർ ദ പാപ് സ്മിയർ ടെസ്റ്റിംഗ്. ഓൾ ദീസ് തിങ്സ് വിൽ ബി പ്രൊവൈഡഡ് ബൈ ദ ഗവൺമെൻറ് ഓഫ് ഇന്ത്യ. So even job opportunities are also, I am just focusing. So they have a post under this particular program, especially under the government. They have two posts. One is the senior pathologist post, and the next one is cyto technician post. So these two people integrate the program. Next one is sterilization bed scheme. What do you mean by sterilization? We all know that. So when a person is undergoing tubectomy or vasectomy, they should have a facility to get admitted in the hospital for a minimum number of days. So it should be reserved, because sometimes when they go to the hospital for a sterilization, and if these services are not provided in the hospital, the people used to hesitate and they used to come back from the sectors. So it should not happen. So the government is focusing upon a scheme which is known as sterilization bed scheme. So this scheme was introduced by 1964 by the reservation of sterilization bed in government or in any voluntary organization or in the local body institutions. It provides facilities for tubectomy operations, as the bed for such cases were not readily available in the hospitals. That's what I was telling. Usually in hospitals, sometimes during the rush time, or if they have the lack of beds, they used to tell to the people that can you come later, or can we do this facility in the coming month, so that the people are getting demotivated. So it should not happen. If anyone is coming into the front line for doing a sterilization, they should be highly motivated. So for that, the government has started this scheme providing a bed reservation for the sterilization procedure. A recurring amount of around 45,000 rupees will be given for the maintenance of that particular hospital, or for the maintenance of that particular sterilization beds or the local bodies, if they have achieved around 60 tubectomies per year. So at least if one bed is reserved by the government, that means in that particular bed, if around 60 tubectomy cases has been admitted in that particular year, that organization will be getting an amount of 4,500 per year as a reward money, or as a funding system which is coming under the sterilization bed scheme. So I hope it will really focus and it is really focusing and encouraging the sterilization methods or the sterilization facilities provided by the government, which can really bring down the population in India. Next one is urban revamping scheme. So urban revamping scheme, it has been introduced with a view to provide improved service delivery, outreach services of primary health care, and even the family welfare and the maternity services in the urban areas, particularly focusing upon the slum areas. So urban revamping scheme is the same as in the rural area, where we provide the primary care or the sub centers and the PHCs, what they do. So when they do the outreaching services, here also when they provide the primary health care, which provides the outreaching services, when they go to the field and they find out the cases, such type of cases when we find out, and such type of care when we provide, like family welfare care and maternity service care when we do in the urban slum area, this scheme used to have a very good support. So that is their major function. Even the state government, actually they have established various health posts and even city family welfare bureaus also for that. So they have the state government has established various health posts and even the city family welfare bureaus, especially for this urban revamping scheme. They just want to bring up the backbone, or they want to strengthen the slum areas of the urban. The City Family Welfare Bureau has the responsibility of coordinating, monitoring and supporting all the family welfare services provided by various institutions in the city. So as I have told, the government, the state government and the various voluntary health agencies, they all provide so many activities or so many services for the family welfare. So all these services has been coordinated, monitored and even supervised by this family welfare bureau. So it is their responsibility under this particular scheme to coordinate all the family welfare services which is given by all the institutions in the urban cities. The last one is the Urban Family Welfare Centers, otherwise UFWC, Urban Family Welfare Centers. So it is functioning since 1950s to provide the family welfare services in the urban areas in all the states and the union territories on the basis of population coverage. So as per what is the population, as per that there will be more number of urban family welfare centers. So this program or the scheme has been started from 1950s in India, and it really provide all the family welfare services focusing on the urban areas in all state and in all union territories in India. These urban family welfare centers will be reorganized into health posts gradually year by year, as when these cities are considered as expanding under the urban revamping scheme. നമ്മൾ already urban revamping scheme kandu. So in that particular scheme they are providing a good back support for the urban slum area. So actually they would try to expand the program so that all the urban family welfare centers, they will be having a health post gradually. So in the coming years or in the coming decades, we can see that there will not be any urban slum at all, so that all the areas of the urban will be well developed. So these all were the services provided in the urban area. So I hope you have understood about the health services provided in the urban area. These things are not available in a particular area of K Park. So it will be better if you can write a running note in your notebook. I hope you have understood about this particular topic. As I have told, the health administration, that means all the central level, state level, district level, everything will be in detail taught by Sister Smitha in her particular unit. Thank you all students.